guys, welcome back to Medical Coding with Blue. Today's episode is all about what to expect in your first year working as a medical coder. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so if you have gotten your first job in medical coding, congratulations. The things I'm going to be talking about today are some of the average things that you can expect to experience as a brand new medical coder. Keep in mind, all facilities are different and they have different rules. They have different leadership. But these are the things that I've experienced in my times starting as a new medical coder. And it really all depends, again, where you are. But these are the things that I've experienced, so I'm going to share them with you today. One of the first things that you should expect is a pre-bill, right? So what pre-bill means is they will give you a set of records. Sometimes it's 10. In my situation, when it happened to me, it was 10 records. So what I would do is I would code these 10 records out and I would turn them in and they would give me another 10. Meanwhile, an auditor would check 100% of my codes just to make sure that I was coding appropriately and I wasn't missing anything. And the reason that they do this is because they want to make sure that you are applying all the guidelines appropriately. They're still getting to know you as a coder, because you can pass an assessment test, certainly, but being in the real world, like in their systems, is really going to be different. And it's going to show really quickly in these pre-bill encounters. So once the auditor goes through, and if everything turns out great, what they do is they say, okay, you can post these for final billing. So you go through and you enter in all of your codes, and then it goes off to billing, and that's all there is to it. Now, in some instances, some people are doing the coding and the billing. I'm just talking about the coding, okay? So if that is your job, this is for you. So I sent it off to the billing people, and they send it off to the insurance company. So then I work on the next 10. And typically it's 50 records. So you have to get over a certain percentage of accuracy. Usually they want you to be over 95%. Some places it's 97%. It really all depends. So in my instance, when I did it for the level 1 trauma hospital, it was 95%. So I was like, okay, cool. And I was able to pass. Now, they will give you 50 records, and if you do really good, then they will turn you loose into the system and you will start coding regularly. There's nobody there to like look over your shoulder to make sure that you did everything correctly. But this is the other thing to expect, is that some facilities will do monthly audits, some will do quarterly audits. What an audit is they will pull a set number of records for you, and maybe it's 20 records, and they will check these. Basically, they're doing a spot check to make sure that you're picking up things appropriately. And if you're not, it's a good way to kind of like, okay, catch before you continue making the same mistake or different mistakes or whatever. So as they're going through your audits, they give you your totals, like however much you were accurate and what their findings were. Well, the thing about an audit in coding is that you can have a rebuttal. You can defend yourself. You can defend why you selected a particular code. But in order to do that, you have to have an official reference. And an official reference comes from Coding Clinic, CPT Assistant. Now these are the two, basically they're just where questions get sent into the editors of CPT and ICD-10 CM and ICD-10 PCS, and they answer these questions. And so you can use that as a reference for why you picked up a certain code, because not everything is clear as a bell in the guidelines. So sometimes if you know that you're right, try to cite, a Coding Clinic or CPT assistant that may help you in applying your situation. So you have to come with an official reference of why you feel that you were correct. Because even though that auditor has experience and maybe they've been coding for many years, it doesn't necessarily mean that they're always correct. We are all human, okay? And everybody has a different way of looking at things. And sometimes if an auditor is not particularly strong in a specialty, it'll show. And maybe they spent their whole career, doing like cardiology, but they really kind of suffer when it comes to coding for musculoskeletal conditions and injuries. And again, it can show. So that's where, again, you have to have an official reference, something from the guidelines, coding clinic, CPT assistant, something that says that you are correct. You cannot go onto the internet and cite an AAPC discussion board thread that agrees with you. You can't do that. That's not going to fly. It has to be something official. Okay, so that's the thing that you guys should know. And it's very important to know how to do your research, because again, sometimes the auditor is not always correct, especially if they cannot show you why they are correct. If there is an official reference, they are supposed to give it to you when they have a finding. When they say that you coded this incorrectly, they're supposed to give you a reason why. Not all auditors will do this, okay? So you have to watch out, because again, it really all depends on who you're working with and their level of expertise and skill, and your level of expertise and skill. The other thing that you should know is this: if an auditor tells you that you are incorrect with your reference, they usually have like a set of steps that you have to go through. If you don't agree with your auditor, there's somebody else who can serve as a mediator, who can look at it from a third-party point of view and be like, okay, and it's usually going to be like the coding supervisor, or it's going to be the head of the department, the HIM department. So they're usually the tiebreaker. There's somebody always designated as a tiebreaker, but you do have that ability. So don't just take an error just to say, okay, yeah, I agree immediately. If they're giving you a reference and it's explained, then clearly, yes, they are correct. But if you have something and they don't have anything, then that's when you do need to speak up, because it's part of our ethics that you do that, okay? So that's the whole auditing process. And sometimes your audits will come out very clean and really good. You'll do great. And maybe you'll meet that accuracy standard. Again, accuracy standard can be 95% or it can be 97%. Just depends on the facility and what they set their standards at. But don't panic if you, for some reason that month, maybe things were a little weird in the documentation and maybe your accuracy came out to 90%. Don't panic, you're not going to get fired. It's a lot of money to hire you, let alone get you past the pre-bill experience, and then to, just to let you go immediately. It doesn't make any sense. So they will work with you if your accuracy dips, but don't let it keep dipping, okay? Show some improvement, and so that way they know that you're not just there to collect a check and go home, because then that can show really quickly too. So always try to make sure that you are paying attention to what you're doing. Again, sometimes it just happens, but you always want to strive to do your work accurately. Accuracy will always take precedence over production. Accuracy will always take precedence over production. This means that you have to be right when you are coding these things. Some charts, some encounters will take you a little bit longer than others, because some of these patients come in with pretty complex conditions and you got to sit there and go through the documentation. And if that's the case, and maybe you didn't meet your productivity, your average productivity for the day, and average productivity in the outpatient setting is at a reasonable productivity is between 80 and 150 average encounters per day. If the facility is telling you need to be coding more than this, you are in a data entry position. There is no reason that anybody should be coding more than that, okay? Especially in the outpatient setting. So even if the encounters are real easy, you still have to be able to pay attention to what you're doing. And trying to push the people to do more than 150 average per day is ridiculous. So again, I hope that you have gotten into a place that has a reasonable productivity rate, because there are some people out there who are foolish enough to believe that AI can do this, and it cannot. It cannot critically think like we can, okay? And so for all those people that say, oh, well, no, AI is taking over, you clearly have no idea what we do. And you clearly have no idea what you're doing. You can look at the news and see all of the mishaps that have happened with AI looking at medical documentation. I'm just going to leave that one right there. So with that said, with your productivity and your accuracy moving right along, you will be able to adapt wherever you're going, okay? Because in clinics, especially if you're working in a clinic, a lot of times they do a set procedures, right? They have their average procedures that they always do. In the orthopedic clinic, for example, I do arthrocentesis, which is pain injections. I do those. So I do them for major joints, intermediate joints, minor joints. I do those for all of those. I do bicep injections. I do closed treatments of fractures and things like that. And in podiatry, I'll do like nail removals. Okay, so there's all those procedures that are the average that it happens in that clinic. So you want to make sure that you ask what are the average, procedures that are performed in this clinic, so that way you can get an idea. You can consult your CPT book if you're working on the outpatient side, or if you're on the inpatient side, then you can kind of look when you're in the records to kind of see, and you'll get a feel of those after a while. It may take you 90 days to get used to it, but it's just gonna take you some time. It's just a period of adjustment. That's all it is. And then once you get the hang of it, it'll be no big deal. You'll be going from clinic to clinic. Trust me, that happened to me. But when you are managing your productivity, you have reasonable productivity at your place, you have reasonable accuracy at your place, then you can kind of breathe and relax, right? The other thing that you will be expected to learn and to get really comfortable with is, of course, the electronic health record. Most places use electronic health records. And so whether it is a big company like Epic, or maybe a smaller one, it really all depends on the size of that practice. And everybody's electronic health record is going to be different, every facility, because even though they may use the same vendor, they may have a different package. So that's all a part of learning this industry. Okay, so you will have those things. You will have training on HIPAA. Bare minimum, you will have to have HIPAA training. HIPAA training is annual. It is once per year, and so you're going to be getting a refresher every year about HIPAA and making sure that you understand. Plus, you will have whatever other education that facility is going to require of you. For my facility, we have very specific things to my facility that I have to maintain that training. If I don't, they can lock me out of the system. And they can lock you out if you do not complete your training. But your supervisor, your coding lead will let you know. And usually you will get emails to remind you that, hey, you have an annual training that's due. You have this training that is due, and they'll make sure it's a urgent alert, so that way this is serious. But that time that you spend doing those trainings, that's not considered coding time. Some facilities, you'll have to fill out a productivity report. Others, they don't really concern themselves with productivity reports. I think it's still important to keep track of what you do in a day. If you are not required to fill out a workload report, I am. But if you are not required to fill out a workload report every single day, you still need to keep a journal of what you did. If you did training, how long was that training? If you were talking with providers, you need to make note of that as well. If you had to email them a lot, again, that's provider communication time. You want to make sure that you have that documented in like a work journal, okay? Something that you can keep on your work computer, so that way, in case something happens and they're running a report, because in the background, your supervisor, your coding lead, anybody in the department can run a productivity report on you. They can run this report, and this report can give a detailed breakdown of what records you touched, how long you were in that record, and what pages you were on in that record. So there's a lot that can be gleaned from this data report. So if they say, okay, well, it looks like you were spending a lot of time in this one record, and this was a very easy record. What were you doing? Okay, and if you said, oh, I'm working at home, so I'm just going to go run out and do an errand, and you didn't tell your supervisor, that's grounds for, firing, because you are not where you're supposed to be. You have to be working when you are working. Even when you're working at home, you still need to be doing your job. You can't be out there running around willy-nilly. I don't care who says what. You can't be out there. That's not what they pay you for. They pay you to be in front of your computer and working. Okay? So, that aside, keep a work journal so that way, again, you can look back. Oh, yeah, I was doing this or I was doing that training or whatever. Keep track of that so that way you can have it in case you need it. All right? You will meet coworkers. You will meet your coworkers, whether you are in person or you are online. Even if you are working remotely, you will not escape the personalities of other coders. So some coders, especially those who have been in the industry for a while, some of them will be happy to help you, others will not. It really all depends on the individual. I can't say either way. But if you are self-sufficient and you look up your own answers and things like that, you will know after a while, like if you need to like kind of figure one out and you're kind of on the fence and you don't want to ask the coding lead, maybe you want to discuss it with one of your peers, you'll know who to talk to after a while, who's cool, who's not cool, to be able to ask. But you always want to make sure that you're protecting private health information. Don't be sharing things willy-nilly, all right? You can talk about situations in general terms. That's always a good thing. If you need to discuss it, make sure that nobody can hear you. But that way, no private health information from a patient is being shared. It's just a general conversation about this scenario, okay? That would be my advice there. If you find yourself struggling during this first year of being a medical coder and you say, gosh, Blue, I feel like I don't know anything. Like I passed my certification and then, I just feel like when I'm here and I'm at work, I'm just like getting everything wrong. Well, if that's the case, if that's what you feel like, you need to go back to the workbook. You need to go back to the workbook. You need to work through that particular chapter, whichever specialty you're coding for, or if it's family practice, you need to start all the way at the beginning. Or you need to isolate what it is that is throwing you. If it is that it's injury coding, then you need to go over the musculoskeletal section of the ICD-10-CM book and the injury section and the external cause section, okay? If you are coding for mother-baby, you need to be looking over the OBGYN section as well, okay? Whatever situation you're in, whether it's cardio clinic, neuro, any of those things, you need to be specifically targeting that in the guidelines, in the ICD-10-CM coding guidelines, and in that particular section of the book. And getting yourself really familiar with the diseases that are in those particular clinics. That's what I did when I was put into the pulmonary clinic to help them. Pulmonary clinic was not doing so well. And so my boss knows that I'm a digger. I dig and I will fix things because that is what I do. I investigate. So what I did was I had done inpatient professional services, which means I had coded for pulmonary patients when they were up on the floor. This is different from coding for pulmonary patients that are in the clinic, because now you're involving like the breathing tests and all these other procedures that they do to measure like, their lung capacity and things like that. So with that in mind, and then you can't code certain conditions with other conditions because it's already part of that condition. The only way I was going to be able to learn that was I went to the American Lung Association and I started educating myself on all of those conditions. I started Googling the procedures that they do perform in that clinic, because I went up and talked to one of the nurses and I asked her, because she was there and she helps with those procedures, and I said, can you help me? I'm new in this clinic, so I just want to know what y'all do. She's like, oh, sure, no problem. And so she's showing me the equipment and what it looks like and how it works and how long do the patients stay in this equipment. I was like, wow, this is really neat, but it made a difference because I could see it. I could see and I could understand, like, what does this mean? I didn't know what all these things meant, like, what is this? Having asthma myself, I knew what some of those procedures were, but I didn't know about all these other advanced procedures. And I was like, okay, well, this is different, So that's what helped me to learn when I just got dropped into a clinic. And I was able to get adapted really quickly, because I was like, okay, it took me a couple of days to figure it out, but I was able to get it figured out, you know? And again, having that hands-on interaction really did help me. And having a wonderful nurse that did show me around, and it's like, okay, this is what this is, and this is what this does. And that answered all of my questions. And so I was able to be a better coder for them. All right. So again, if it's your first year, it's okay to ask questions, especially if you're in the facility. If you are in the facility, that is wonderful, okay? Because I don't believe that new coders should be remote coding their first year at all. But that's my own personal opinion, okay? And I say this for y'all's benefit, because it's a different world from school coding versus the real world, okay? It is completely different. And so that's something that you all have to understand. When it comes to the coding, it's going to look really different. But it's not impossible, and it's not like you'll never be able to catch it. You will be able to catch on, but you just have to give yourself the opportunity to learn this stuff, all right? And be patient with yourself. And in this first year, you got to show yourself a lot of grace, because you're going to make mistakes. You're going to get an audit back, and you're going to be like, that was a really stupid mistake. How did I do that? Don't beat yourself up too much, okay? Just remember it and move on, okay? Remember it so that you don't repeat those same mistakes. You know, anytime I've had audits before with my supervisor, and we go back and forth on some of these, and so I win some and she wins some. And some of those I'm like, man, I didn't even know that, or I didn't even think of that, or I didn't see that. And so my boss told me one time, she said, you know what I like, Blue? She said, I like when we discuss something and we both agree and you never do it again. And I go, it doesn't make sense to keep doing the same mistakes over and over again. I try to learn, you know, just like anybody else, any coder would, you know. And sometimes things happen. Sometimes you see something and, oh, I didn't even see that, you know. And it's just a matter of correcting it and moving on. You know, everybody does. Everybody goes through an audit in this process. But the important thing is to be as accurate as you possibly can, okay? That's the biggest thing, all right? But never stop educating yourself, especially in the first year. Don't get, you know, where you, oh yeah, I did really good on my first audit, I did really good on my second audit. You have to really self-evaluate and make sure that you are really doing well. Because again, that auditor that may be auditing you may not have the same level of experience as you. And they may say, oh yeah, that looks right. But lo and behold, you know, but it really, again, it all depends on who's looking at your stuff. So always make sure that you stay on top of the latest coding clinics that come out when you're working in a facility, or if you're working remotely, whatever, and you're working with an encoder. Usually there's a little stack of books when you open up the encoder, at least for 3M it does that, or Solventum they're called now. But there's a little stack of books that you click on, and there's all your references there. It says Coding Clinic, CPT Assistant. I do have an older video out that has no commercials for those of you who seem to get offended by commercials. It's commercial free, but I did demonstrate what it's like to go through the encoder. So that way you can see, you know, what it is. But I didn't open up the references. But when you do that, again, you can see all of the references. So if you have any downtime and you just want to read some of those, like on your lunch break or something, trust me, it is a really good read. And just reading them will help put that information into your brain. You don't have to memorize it. It's just there to help you. Okay, so that's just one of those things. The other thing is, in your first year, you will be meeting your providers, all right? Whether meeting them in person, which is always best, or through queries. If you are going to query your providers, make sure that you send a separate email first identifying yourself. You always identify yourself before you send any query. Because if I'm a doctor and a coder just sends me a query, I'm going to get irritated, because first of all, who are you? What is it that you think I'm doing wrong? First of all, who are you? So that's the thing. You need to let them know who you are, and you need to let them know that you're there to support them and to help them, and if they have any questions or anything like that. It's better when you do it in person, because email is a little different, and you have to make sure that that email is well written. If you're going to go the email route, make sure that it's well written. You can't be scared of these doctors, guys. Don't be scared of them. They're people just like you and like me, all right? And a lot of times they don't know what it's like to have coders just email them or come up to them and introduce themselves. They don't know what that is, because it's foreign to them. It's usually somebody else, a CDI or the clinical educator that comes along and introduces themselves. It's never usually the coder. The coder's always the one that's behind the scenes. But it doesn't have to be that way. Their interaction with you should not only be queries, hey, you're doing something wrong. It needs to be a good balance. They need to know who you are and that you're there to support them and be their teammate and be available if they have questions. And you never, ever, ever say, I don't know. Because if I heard that from a coder, I would say that coder's incompetent. I don't want to ask that coder, and I don't want them discussing anything with me because they don't know. I want somebody who's proactive and says, I need to do some research on that and I'll get right back to you. That's the coder I want, because that's the go-getter. That's the one that's not going to leave me high and dry, right? Like, oh, okay, well, just forget your question. No, it's important that even though you may not know it, but somebody else will know it, or you can let your fingers do the walking and do the research. I'm just saying. So with that said, I'm going to go ahead and wrap this one up. But that's some of the things that you can expect in that first year as a medical coder. It's going to be an awesome experience. It will be a very frustrating experience sometimes, not going to lie. But it's not for naught. This is the growing phase. This is the growing phase of your journey. And every one of these experiences you should be thankful and grateful for, because without them, it's not, you wouldn't be the fabulous coder you will be a year from now, right? The more experienced coder that you will be a year from now. I'm just saying. So with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.